We are here today with Dr. Amy Robinson from Restore Your Core, and we are going to learn so much about women's health, about athleticism, about returning to your physical activities after you have a baby. We are going to talk about the needs of our young athletes as they are developing into young women and some things that we need to maybe we don't even know about, but we really should. So let's just first talk a little bit about you and your background. How did you get into what you do? Where did you go to school? These kinds of things.
So it's hard to believe, but I've been a physical therapist for 28 years and been practicing pelvic health about 26 of the 28 years. And I originally went to school thinking I wanted to do rehab with clients who had strokes because my grandfather suffered several strokes as I was growing up.
Wow.
But then God placed pelvic health in front of me. Really, as an athlete in high school, I ran track, I was a cheerleader, a swimmer. And I was leaking urine in high school and didn't want to tell anybody. My mom was a nurse. She actually was an OB/GYN nurse for a period of time, working on the labor and delivery unit. And it's embarrassing. And so that piqued my interest. We had a 45-minute lecture in physical therapy school, which is really sad.
Wait
That's
a
all we
minute.
had.
How many years is physical therapy school?
7 years of physical therapy school, but a 45-minute lecture specifically related to
One
women's health.
45-minute
Yeah.
lecture on women's health in 7 years of physical therapy.
Yeah.
Wow.
Yeah, it's sad, and it hasn't gotten a whole lot better. I'd say we're starting to turn a corner, but we need to do much better. And I am very passionate about talking about young girls, and young girls needing to learn about their pelvic floors. I don't know why in the United States we're so afraid to talk about the pelvic floor and periods and sexual
Hmm.
function and all of the things that will matter down the road. Um, in young athletes. And
Hmm.
so we need to do better. And it's
Hmm.
something that I've been on a mission for a long time, and I know it's important to you as well.
Yeah. Well, with that segue, let's jump right into it. So, young athletes, young girls, what ages are they starting puberty?
I mean, it's getting younger. We're probably anywhere between 10 and 12, maybe. Sometimes Hispanic girls a little bit earlier.
Yeah.
It really just depends.
Mhm.
It's all this food we're eating, and it's all the hormones that are added to the meats and whatnot. It's really starting a lot younger,
Okay. And these girls, they love to be active, or at
right?
least, we hope that there's something that they find that they love that keep them moving. There's some sports like cheer and gymnastics and dance. And we've talked about this before where if it involves falling, so maybe you're doing a tumble and you land on your hips, or maybe you fall off the balance beam during practice, or anything that involves like falling to a land. Let's talk about that from
Yeah.
from your perspective.
So there's so many injuries that occur, but you think about it when we're young, you just get up and brush yourself off and you keep going. But there are so many things that happen, when you land on your butt, and you see this a lot with gymnasts, volleyball players,
Mm.
soccer players, that tailbone a lot of times will have tailbone pain, and that tailbone shoves up and underneath, and it shortens the pelvic floor. And so we see it a lot in especially gymnasts where they come in and they're having urinary symptoms, or they're having tailbone pain or low back pain or hip pain, but they're also having like maybe urinary urgency frequency or constipation issues. And
Mm.
nobody's really looking at what's happening with the pelvic floor. Everybody is, focused on all the other things, and oh, just give it time, you will heal. But if we can start addressing some of these things early on for these young girls, it can make such a huge difference. I will say that one of my good friends, her daughter is a gymnast, and she called me because her daughter, she's really good. She practices a lot. Um, she's done great things, but she was having lots of urinary issues and more like bladder and urethral pain. And everybody was just looking at UTIs. And,
Mm.
at this point in time, she was maybe 11, not sexually active. And why would she have a UTI, right? I mean, you can at any
Mm-hmm.
age, right? But she had never had any history. They tested her for it. They still wanted to give her medicine without having a positive test. And, my friend denied that. She didn't want to use it. That messes with the gut. She understands that. But she called me. And so I was able to do some external release work to really help with that. So that's very, very common. Some of the newest research out shows that like 50% of young female athletes
Mm.
have urinary leaking,
Interesting.
right? So there's so
50%.
many other
Yeah.
things that like go along with that.
Yeah. So how might a mom approach such a topic with their daughter?
I really do believe we are just so far behind the curve in the United States of America. In other countries, they openly discuss
Mm-hmm.
reproductive health, sexual health, periods. I mean, we kind of shy away from it here. And I think
Mm-hmm.
it's just really, mom has to be comfortable with herself in order to be able to talk about the pelvic floor. And of course, young girls are going to be like, oh, I don't need to know that, or I learned that in class. But I really do think if you open the door and just start talking, it is helpful. It's really, really helpful. It's something as simple as when a girl is you think she's going to get ready to start her period, really have that conversation about periods and what it means and how to
Mm-hmm.
track a period. Oh, let me tell you, tracking a period is crucial. A lot of times young girls, when they start their periods, it doesn't really start to level out until their mid to later teen years. All of that can affect everything.
Mm-hmm.
And why we're talking about period health, young girls who are having periods that are super, super heavy or really painful, making them miss school or athletic events, that needs to be looked at and looked at early on and not just given a slap of a birth control pill.
Mm.
Birth control pills can really wreak havoc on a girl's fertility many years down the road. And so, these kind of conversations can open the door because all young girls have periods and they're expecting their periods. So it's a really good segue to be able to really start talking about everything
Mm-hmm.
related to the pelvic floor.
Mm. So for moms out there, what are some symptoms to look out for in their daughter that might signal that there might be a pelvic floor issue?
So, girls who aren't having bowel movements daily or at least every other day, girls having to strain to have bowel movements. I also want to say, though, paying attention to if they're limiting their food intake because that also just has effects across the whole system, but specifically it has effects on hormones because if you don't have a great combination of proteins and carbs and healthy fats,
Mm.
that affects the hormones and the ability of the hormones to do their work within the system. And so I think just kind of looking at, are they experiencing leaking? Are they saying that they're having tailbone pain? Are they complaining of back or hip pain? Are they having really heavy, painful periods? Like all of these things can signal a problem with the pelvic floor.
Oftentimes, these issues can be seen as orthopedic issues. And
Yeah,
how do we bridge that gap?
yeah. So they are orthopedic issues, right? I always say we're kind of in a gray area right now. During COVID, pelvic health kind of became a hot topic. So everybody and their brother are claiming to know how to treat pelvic floor issues.
Mm-hmm.
And so in young girls, no, we don't do internal pelvic exams unless it is indicated and like their OBGYN or their PCP wants us to do a pelvic exam. The young lady agrees to it and the mom agrees to it. There are a lot of ways, though, externally to check the pelvic floor and make sure that everything is working together like it should be. And so, okay, I just lost my thought. What did you ask
Okay.
me?
Just sometimes these issues look like orthopedic
Oh, yes.
issues.
And so we do have to look at the child as a whole, the adolescent girl as a whole, making sure that we're not missing anything. And when I say a whole, we don't just look at the pelvic floor. We're looking at the whole person. The breathing diaphragm has to work with the pelvic floor. The transverse abdominis and the multifidus muscles have to activate. That whole inner core canister must be anticipatory and it must work just milliseconds before the big mover muscles start working. And so a lot of times those inner core muscles are shut down from a very young age, and young girls are like breath holding a lot, straining, pushing down on that pelvic floor. Little things that can make a big difference in order to like help improve their performance, but
Mm-hmm.
help keep their pelvic floor safe. working from a young age moving forward. So yeah, you have to look at the whole person.
Mm.
One of the big things, the hip. A lot of young girls have hip pain. There are a lot of young athletes who have labral tears in their hips. You know, with a labral tear, the obturator internus, which is a big hip muscle, is located on the inside of the pelvis and actually shares connective tissue or fascial attachments with the labia ani or pelvic floor muscles. And so a lot of times we really have to make sure that the hip is working like it should be, because that has a direct impact on the pelvic floor. Same with low back, right?
Mm.
SI joint dysfunction. Everybody knows what SI joint dysfunction. Pelvic girdle dysfunction, pubic symphysis, right? So a lot of times, like with gymnasts, they have, or dancers, they have a leg that's stronger that they bound off of.
Mm.
And a lot of times that can actually cause a slipping or a um, shifting of the pubic symphysis joint. And so that also can cause like bladder type symptoms, urethral type symptoms. And so all that orthopedic stuff has to be ruled in and ruled out, and not just look at the pelvic floor. And quite frankly, especially with athletes, a lot of times pelvic floor therapists are just putting patients on a bed and looking at them lying down, and that's not functional. We have to get them up. We have to look at them. We have to break their movements down. We have to figure out where they're having the problems. It's usually just the littlest things that make the biggest difference.
Mm. So let's take this young girl that presents many of the things that you talk about. Their symptoms get overlooked. No one ever directs them to a pelvic floor therapist. They get into their 20s, early 30s. They're ready to start a family. Now, what are they at risk for?
So a lot of times infertility, unfortunately, and I have a personal story with that, and I can speak to that very openly. I don't mind sharing my story. It's mainly why I'm here. I started my period in fourth grade, and very young, and then just completely gone in fifth grade, started again in sixth grade. Very, very heavy. And because I was a swimmer and I was an athlete, I had to be able to use tampons at a young age. And so, very, very heavy flow. At that point in time, what do? They stick you on birth control. So, I was on birth control from seventh grade clear through until I hit about 25 years of age.
Wow.
So, when they took me off birth control, I had all these issues that nobody knew. PCOS, endometriosis, none of that was diagnosed. And so, at that point in time, you're trying to figure out how to fix all of that. And unfortunately for my husband and I, it wasn't a fixable problem. I say now, um, God doesn't give you something that you shouldn't do something with, right? And so this is my platform. Like I want to be able to help young girls and moms help figure this stuff out early so that they don't end up with fertility issues where they're needing an IUI, IVF. And a lot of my clients that I see, due to religious reasons, don't want to take that path, rightfully so. But then, it kind of limits them at what they can do, what options they have. So if we start looking at things much, much younger and you start fixing them earlier, it's incredibly helpful. Saves a lot of heartache.
Yeah. So our young girl is now grown up, ready to start a family. Let's say she's able to have a family. So what do you recommend post having a baby, postnatal,
Yeah.
before you're ready to get back into your running routine or your cycling routine, or maybe you want to lift heavy weights? Like, I'm ready, I feel good, I've spent 3 months. The doctor said, yeah, you can do whatever you want.
Yes.
What do you think?
So what I think is every woman after every single childbirth should have a pelvic floor exam by a therapist who specializes in pelvic floor therapy, who actually has done training for internal pelvic floor examinations, looking at a whole body approach, right? We're really behind here in France. I believe every woman gets, it's either 6 or 8 visits of physical therapy after every single childbirth.
That's
just
great.
flat out,
Yeah,
right? I
that's
think the
great.
Netherlands does something similar. We just don't do that here. And so really kind of what it's like is a woman waits for her 6-week checkup, and once she goes through that 6-week checkup, then they say you're good to go, right? And so has anybody really looked at the pelvic floor or the abdominal wall? Usually not. Usually that 6-week checkup is just to say, yes, you've healed from the childbirth. You are free to do what you want to do. There's a lot of question, when should athletes start back into sport. And I'm going to tell you, it depends,
Mm-hmm.
right? If you're somebody who is, like, say, an Ironman athlete who trained the entire pregnancy, you might be able to go back sooner than somebody who maybe was sedentary, right? So it really kind of depends on how much you were kind of loading your body before the birth and if you had any complications, right?
Mm-hmm.
Because if you had prolonged pushing, vacuums use, forceps use, significant tearing, an episiotomy with additional tearing, you might really have to wait. Those tissues really do need to heal before you go in and really start loading on those tissues. It's going to give you better luck down the road, right? I mean, it just takes time to heal. So, in somebody who's had significant injury, you probably do want to wait for 12 weeks before you really start loading. That doesn't mean you can't start doing other forms of exercise, but if you have an assessment and you have somebody guiding you through, then you have the better chance of doing the things that you should be doing versus maybe overloading the pelvic floor too soon.
And how soon can a woman get an assessment from someone like you after
So,
having a baby?
especially if a woman is in pain, they can come in as soon as they need to come in. Now, we don't do pelvic floor assessments until they have been cleared by their OBGYN. But if we need to get early clearance, we can actually call and talk with their physician. And that does happen every once in a while, right?
Yeah.
You just have to be mindful of what's happening. You know, if you've got healing that needs to occur, you don't want to go in and disrupt the healing. But if somebody's in a lot of pain, they can't sleep, they're having troubles breastfeeding, they can't take care of their child, you need to take care of mom so mom can take care of baby.
Let's say someone is urinating post-pregnancy and they just decide they're going to go back and run and it's probably going to get better, right?
Yeah, well, not necessarily. I would say if you look at research, if the leaking isn't gone by 6 or 8 weeks postpartum, it's probably there, and you really need to have an assessment. It's usually, again, the little things that can fix that problem, and the sooner you address it, the easier it is to address. I always say it's kind of like peeling back layers of an onion, and so the fewer layers you have to peel back, the less treatment you need, right? Versus if you wait, a lot of women wait 5 or 6 years before they get help, sometimes longer. And it can take a little longer, not always, but the quicker you address it, the better off.
Yeah. And what other questions do I have?
Ask me about the MSella chair.
So there's this new thing out on the market called the MSella chair. What is this?
So it is a chair that you actually sit on. It's magnetic in nature, really more E-stem in nature. I think they use some kind of magnet system. It actually does contract your pelvic floor. I wouldn't necessarily say it's wrong, right? Because it can help people improve their pelvic floor strength. However, the biggest problem is that it's not functional. And you're not solving all the other issues with the pelvic floor and the breathing diaphragm and everything that has to work together as a unit. So I always say if Kegels were the fix, every woman would do them and no woman would forget them. So it's not all about the Kegels. It's about, it is really truly about making the whole system work together as a functional unit. If I had a woman who was really weak and really wanted to try to improve her strength quickly, then we might suggest the MSella chair, right? In conjunction with physical therapy. But if you have too much pelvic floor tone, if you're holding too much tension, it can actually cause pelvic pain, which we have seen in our office. And so it has to be used for the right person at the right time in order to make everything come together and work.
So we are a Pilates studio, gyrotonic studio. What is your opinion about utilizing such movement methods in an effort to help with the pelvic floor?
Yeah, I very much am in agreement with it. I will say I'm very particular and picky about who I partner with. I want to make sure that when we send our clients to someone like yourself, I want to make sure we have communication so that you know your staff understands what we're doing in physical therapy so that you can kind of marry it in with your Pilates or gyrotonics regimen. Super helpful. We want to keep our moms active. We don't want to take them out of their classes. We want to keep them moving forward. We just want to work as a team with with other like-minded professionals to make
Mhm.
sure that they're getting what they need and what they deserve.
Yeah. And we do a great job partnering. We often have clients that present different symptoms, such as a prolapse or at different degrees, and being able to communicate with you about things that they can do, things we need to be cautioned about, and us being able to put the client into a position that helps facilitate strength rather than creating additional unnecessary pressure is always the goal. So,
It's very, very helpful. Um, there's a lot of one size fits all programs out there, and that's where we see patients getting hurt. And the sad thing is, and what most, I think, fitness professionals don't realize is a lot of times women just don't come back. And it's not because they don't want to exercise, it's either because they're feeling pelvic pressure or they're leaking urine
mhm.
or they're having a lot of low back pain. And because it's like a one size fits all program or a group class, these women just don't return.
Yeah.
And so we do want to make sure that we're having those conversations. And I personally believe that every fitness professional really should be asking all clients just a short question answer survey of, do you have urinary leaking?
Mhm.
Um, do you have any low back pain, hip pain? Um, do you have any issues with your abdominal wall? Because a lot of women will have a diastasis recti, which is that separation of the abdominal wall.
Mhm.
Do you have period related pain? And I really do feel like fitness professionals and pelvic physical therapists should be teaming up. They do in a lot of other countries. I just feel like in the United States, it's almost more like this pull for who's going to keep a client. And
Mm-hmm. It becomes
I
about the
don't believe
business
in
rather
that.
than,
It,
yeah,
it's
what's
really not
best for
about
the
the
client.
business. It's about the client.
Mm-hmm.
And I say all the time, if we have a client who says they can't afford to see both you and I, we've worked together many times
Yeah.
where I might put somebody on hold so they can come work with you for a bit, and then
Mm-hmm.
you put them on hold so
Mm-hmm.
they come back
Yep.
and they learn new strategies, and we work it out that way.
Right.
And so I really would love to see more of that collaboration because there's enough business for all of us,
Yeah.
right? I
Yeah.
mean, we need to be lifting these clients up and helping them get back to what they want to do.
Yes. Yes. I love it. One more topic I'd like to address, and I think it's even more not talked about in the closet than women's health is men's pelvic floor health.
Oh, yeah.
And oftentimes when a male client comes to me, I will see diastasis in their abdomen. I will see their belly like pushing outwards every time they try to lift their head up, and there's this little dome on top. And um, that's just from a fitness perspective. From a pelvic floor perspective, what are some things that someone like me needs to be cautious about, or some red flags that I need to pay attention to that says, "Ooh, you need to see Dr. Amy."
Yeah, so a lot of times men are very tight-lipped about any issues that they're having. So again, maybe a simple questionnaire might solve some issues. Most men aren't going to have leaking unless they've had a prostatectomy, maybe they had cancer,
Hmm.
right? Then they're more at risk for leaking. But other men might be having constipation issues, abdominal bloating, the diastasis recti. They might have intermittent penile or testicular pain, right?
Hmm.
Scrotal pain, perineal pain. But a lot of times nobody's asking about that, and men usually aren't going to openly fess up and say they have those things.
Hmm.
But usually it's just lots of little fixes that actually can solve the issue. Sometimes the start of erectile dysfunction, especially young men. A lot of men think, oh, I have erectile dysfunction. I don't have enough testosterone, right? A
Mm.
lot of times they have way too much pelvic floor muscle tone. And if you can decrease that muscle tone, then, that's critical because basically everything has to be able to fill with blood, and then you have muscles that trap that blood in, and you have fascia that is really, really strong. But if they have too much tension, they can't trap that in. And
Mm.
so, erectile dysfunction, penile pain, scrotal pain, perineal pain, abdominal separation, low back pain, hip pain, all of those things can be a sign of pelvic floor dysfunction in men. We see a lot of men.
Well, if any of this strikes you as something that you would like more information about, Dr. Amy, she is on Instagram. Your Restore Your Core
PT.
PT is your handle, and you can find their website at www.pt.com.
RestoreYourCore.pt.com.
But otherwise, thank you for joining us
Thank
and
you for having me.
have an awesome
You too.
day.